Okay, so try to keep the recordings going. So warm-up activity today, so movement analysis number 2. So we'll do lots of these just to keep you sharp on your joint actions, muscle actions, prime movers, planes, and axes. And today we have 4 different actions. The second one may remind you of one of the ones we did last week. So movement and muscles handout. May have a few extras to do. I have 3 extra movement muscles packets. If anyone else needs one, you can have it. So the first movement analysis is posted here. I'll post this one after class today. So let's just go ahead and work together in groups. Can I turn you loose right from the start? This one? Okay. So remember, check your, and then tie kind of limit your loose so if you can work together and maybe with Sam as well. So I'll turn you loose right from the start on this one, and then we'll get back together and talk about it. Okay. Take it away.
Specifically talking about the shoulders. It's out.
So picture on the left to picture on the right. What's happening at the shoulder? Just the shoulder on that first one.
Would this be external rotation? Isn't how it goes? That's what I like. That doesn't have extension. I'm not sure, because I'm like, if we just ignore the rest of the arm, right, like, then it's just
nothing on there with the scapula on the first one.
So it goes back. Yeah, so it's when getting rotation from.
What? Good job. So if you heard what Jackie said, Jackie knows.
Do we want to share it? Look at you.
The plane might be a little tricky because it's not anatomical position anymore. Yeah.
Oh no, the muscle action is on the side.
Frontal plane, side to side.
Yeah, so it'd be
So the goal here is to make things a little more practical.
Which would almost seem like sagittal, so kind of like, but it's also frontal plane, frontal plane is this, side is this.
Just like the one we did last time. Just one arm
Is it the
versus
same
two.
one about the scapula?
I don't think the scapula one, we were still in that conversation.
Okay, so it's either out of two, I think it's transverse or sagittal, right? So that one you said side. But
How's it
so
going,
my
Sam?
thought though,
Good.
this was sagittal, but even if you have your arm like because this and this, like my shoulder doesn't really move, right?
Right.
And so if we put down an anatomic position that goes up this way.
It does the same,
Okay.
the same kind of movement sagittally.
Right, because your arm's going up.
It'll be sagittal plane, frontal.
Remember that first question, lifting or lowering? Concentric is lifting, eccentric is lowering.
Because I was thinking sagittal
No,
and
this way.
like off axis.
So the planes, that would be in chapter 1.
Sagittal axis is like right
Remember,
here, and then
forward and
the
backwards
axis
for
is
sagittal, side to side is frontal, and then around.
Yeah, the sagittal plane is in the front, which is actually the frontal axis.
and that
Sagittal plane.
technically therefore rotating around the sagittal
Yes,
frontal
that's
axis.
it's absolutely.
Yeah, and the sagittal plane rotating on the plane. It's getting it.
Well,
Like an act on the
I brought
altitude to cross,
cancer today, so.
around which your shoulder would rotate.
I know, I thought I had it down last week.
I know, it's just, because like,
It's gonna be concentric. Similar, except to use your
Put them together.
I think so.
oh yeah.
If you're ignoring the bottom part of the arm, it's like it's extending back.
Yeah, and then you're always like rotating that forearm. Like I told your shoulders
Right.
down, thumbs stuff there.
Well, we're not.
But it's like.
It's weird.
Because I'm like, if you just ignore it, like just looking at the shoulder, even if your wrist rotates here,
It's going.
it doesn't affect your shoulder, it'll be
That's a very good
extending
question.
back.
So the,
Yeah.
It's all you
overjoined is when it equals the flex.
Extend,
There's not
it'd
exactly
be the
asked
same
that,
as
but it's
extending
awesome
back.
that you would
If
recognize
your elbow's
that.
meant to just
So the
extend
elbow-
back.
The elbow
Because
itself
flexion
is
is coming
either flexion or
forward, right?
extension.
This would be flexion, extension.
It's definitely.
Extension.
So
Yeah.
supination
Because I
and
was thinking
pronation
about it,
takes
that
place
I
at
was
the
like,
radial corner of the elbow.
I want you to be on it. Your body is in flexion when it's going.
So there is
in
some
this part,
supination
besides
going
your
on there, but
shoulders,
that's
you
not,
going,
not
but
the elbow that
it's
does that.
extension.
Okay,
Yeah.
so it's the opposite.
Yeah. those funky things.
So we spent it all with you, downward rotation and depression, right?
Let's get you started on this one here. So it's gonna be shortening, so.
Because it's, you're bringing it in and they're pinching towards each other.
Asking for the shoulder. So
So
the
it's
shoulder can externally rotate down here
It
like
would
this.
be complete
Like what I'm doing
abduction
here.
or adduction,
But I can also.
but
do
Yes.
since
here,
we're going out at a
and I
different
can still
angle, like
externally rotate.
this,
See, it's
I
still,
think
So
it's going in,
you can
each
see
other,
from
but
this
like
point,
down.
my shoulder is
So like it's
spinning.
rotating.
I'm just holding it up here.
it's still just
versus
considering, what was that
down.
retract?
So it's the same thing, only I just changed the position and now I'm here versus down here.
Like
So
if I go
instead of
down,
rotate, it can rotate.
down a little lower into
And
the
it can rotate back in.
left scapula and then do that.
So
I can feel my
starting in this picture,
Yeah.
So I think it's going down.
and then the change is simply rotating like that.
It's like
So
downward.
it'd be like if I was at the side and I did this. Only I'm up here.
Because it's like you can feel them do this and you can feel them like pinch together. You bring it back
From here
without,
to here.
but then it's.
Now, that's a very interesting point. So his arms are horizontally abducted. But he's holding it in that position. That doesn't change. So what does change is
The brain is not.
the shoulder joint.
Where do we think that should? So we're just saying.
So it'd be sagittal plane.
Right?
Axis, and then you just look up the external rotator muscles. You have your. So you go right.
Flexion and extension is in the frontal plane, right?
Sagittal plane is anything in this way, and then it'll be on the frontal axis, because it's like the wheel rotation.
Oh, that makes sense. Exactly, it's in the frontal plane, that's in completely missing it.
Yeah.
Oh,
So what if I was down here though, what plane is it?
See, I'm just thinking.
I can externally rotate down here, but now it's not sagittal plane, because I'm going around.
Yeah.
I'm have to watch this, I'm like, so weird video.
Right.
I know. Yeah.
Every function.
Yeah, as if you were like that.
Oh, it's not, it'd be rotating.
That's what I was thinking. It's not transverse, but it's not like that body.
This would be flexion.
This is depression, and downward rotation is gonna be frontal. So whereas if it was just purely protraction,
Because this is the
retraction,
exact.
and transverse, or it was tilting
Yeah.
like this.
So the rotation that's just side to side.
This is exactly how it's gonna be.
So purely, because there's some depression going on too, so it's depressing and then cutting in like that to the side.
Oh,
Depressing and then cutting in.
That's
This is only your second movement analysis, so you're still new. It's gonna kind of start up here, and then it's gonna depress and swing in. It's gonna depress and swing in. So that'd be another 2 minutes or so, and we will talk about it together. second one is very similar to the first one that we did last Wednesday. So think, so if I was to do that same thing down here, it would be transverse. But since I'm up here, it's now forwards and backwards. So the axis would be across my shoulders.
Because it's backwards.
And I'll be rotating from that axis. So forwards and backwards
I
is
think you're right, because I'm like just imagining that this was like someone standing up.
frontal axis, sagittal plane.
But it's I think you're right.
So anterior posterior would be for the
Then I think these hips are.
So the other, sometimes the coronal axis is used in place of the frontal axis. So anterior posterior is great, but that's for the frontal plane. Anterior posterior axis would be for the frontal plane. Yep, you're on the right track.
Yeah, oh my gosh.
All done, actually. How are you showing?
I'm good, how are you?
Well, and they can move in so many
Yeah.
different ways compared to like this is just a single.
Any questions, Brian?
No.
So then, yeah. Alright, so then this.
So, okay, let's go. Okay.
Maybe verify that.
Yeah.
That's like it would-
There you go. So, which muscles are performing that action and then match it up with
It's the same question. Yeah. Like.
I'm just thinking it's really instinct right now. Like, why do you need
Yes, exactly.
That one, I think come back to do. Like hopefully not early, and then there's a lot to erase.
Yeah. The hips a lot easier to do more complex ones,
Yeah.
like this.
Yeah.
Compared to like that one. So this is still, that one's confusing because the arm.
Well, I try to find ones that aren't straightforward,
Yeah.
because that's good for you.
Yes.
Got it all about wrapped up?
Thanks. I know, like 10.
Looks like you're, yeah, looks like you're doing it right. Uh-huh.
Thank you.
Sam, you got, yeah?
One more.
It's gonna be the same.
Okay. Now, all right, you want to look at your extensors
It would be like bringing your legs.
for the hip. So your, I think your hip would be,
Get at the wrong hole.
Yeah.
there's lots of hip flexors, as you can see. Got it, Corey? Sure. So this is, yes, so it's more up and down, but if you were to imagine that in the right position, it would be just like this.
Look at random things.
So,
Have someone move and be a model and be like, okay, you were doing it. Or like give one of these packets to someone and have them model it out for you.
Like do what the picture says and then have to figure it out.
Oh, yeah.
it's like most of your
Plans, kind of.
getting towards the end there. Okay, so let's get back together and we'll just go through it now together. So I try to select ones that are not in the perfect anatomical position because it's good to see things and how they work in practice. So in number one, the picture on the left, how would you describe the position of the shoulder joint to start with? The shoulders are abducted. Okay, so they're not down here, nice, neat anatomical position. We start with the shoulders in an abducted position, so away from the body's midline. Okay, so what you're being asked is what changes between the picture on the left and the picture on the right. So if we're isometric means static posture in an abducted position, and we do this. Okay, so it's turning, rotating the shoulders out. So that'd be external rotation. So you have those three external rotators: teres minor, infraspinatus, posterior deltoid. So muscles are shortening, contracting, which would be a concentric muscle action, plane and axis, sagittal, plane, frontal axis. So what if I was to do that same action down on my side? Then what plane would it be? It would be transverse plane. So we can have the same action taking place in different planes. So it's still the same action, it's just we've moved the arm to a different position. So
For the friends that's out to the side, honestly, that means it's not frontal because, is it because the axis is located in the shoulder, not the arm?
well, so the frontal plane would be side to side. So yes, we abduct in the frontal plane, which is correct, but we're holding that position in abduction as we rotate in and out through the sagittal plane. So the frontal axis would be like a hinge across the shoulders, and then we're moving through the sagittal. So I try to choose unique ones that are not just the traditional. So okay, so the next one had some very good discussion about pronation and supination. So which is good, because when you do things with one hand, you can actively pronate and supinate, which is really nice because it's how the body is designed to work. So your hands just aren't fixed, like with the example last Wednesday. So pronation and supination takes place at the radioulnar joints. So that's below the elbow. So the elbow is a uniaxial joint, so that means how many planes? Elbow flexes and elbow extends. It doesn't rotate. So that's below the elbow joint and above the wrist joint. So we do have muscles that pronate and supinate. That wasn't asked on this, but that's great that everyone was going into that. So it's very similar to last week. Shoulder joint is extending. So initially we're in a flex position. Drawing the arm down to the side is extension. Are we lifting or lowering? So the plates would be going up, which means opposing gravity. So that's yep, concentric, all three. So our extensors, posterior deltoid, latissimus dorsi, pec major, lower fibers. What am I missing? Teres major. Those four. Plane, sagittal plane, frontal axis. And then if you match up the shoulder joint action with the scapula, it's depression, downward rotation, like we talked about last week. Concentric, and then there's three muscles. The pec minor contributes to both depression and downward rotation. So pec minor, and then what were the other two? Rhomboids. Lower fibers of the trapezius in there somewhere? Okay. And then the plane and axis, frontal plane, sagittal axis for the scapula. So depressing and swinging in towards the spine. So right elbow joint, elbow flexes, elbow extends. So we begin extended and then we're pulling back into flexion. So our 3Bs, bicep brachii, brachialis, brachioradialis, and then sagittal plane frontal axis. So just like last Wednesday. Okay, so top of the last page. So again, I really try to look for ones that are a little bit unique to challenge your thinking a little more. So this would be body weight, hip extension. So we're going from a position where the hips are flexed to a position where the hips are completely extended with, now it's important, just like we separate motion at the shoulder and elbow, we also separate motion at the hip and the knees because it's separate muscles that control the hips versus the knees. So it's just the hip joint in this case. So there's 4, gluteus maximus, okay, so, and then your 3 hamstrings, biceps femoris, semitendinosus, semimembranosus on that one. Does that mean that if there's 4 muscles that each of those muscles contribute exactly 25%? No. And that's the beauty of exercise, is the reason we do variations of hip extension is because we can have different amounts of emphasis on those hip extensors. So in particular, if the knees are bent, we'll get to this on the very last slide of this chapter, the hamstrings become what we call actively insufficient. So that means the hamstrings are in a shortened position, so they're insufficient to produce active tension. And so it's the gluteus maximus that receives most of the emphasis in this movement. So hip thrusts would be very similar to this, where you have an exercise where the knees are bent with most of the emphasis shifting to the gluteus maximus. So the hamstrings are actively insufficient. Remember that because we'll talk about it. So sagittal plane frontal axis. And then this one, so this is interesting, a TRX pike, very, very intense. So any type of suspension training, you're getting greater activity of the core, as we say. So going from left to right, what is changing at the hips? Hips are going from being fully extended to being flexed, right? So now typically this exercise is designed to target the anterior core muscles. So those muscles are active, but mostly isometrically. So you're maintaining stability in this region while actively working from the hips. So as you know, it's very intense for the anterior core muscles with this exercise, but we use the hips to load the core muscles in this case. So the idea is to maintain nice postural alignment and isometric tension all the way through the movement. So we have 7 of those, and as you can see, we probably more than any other muscle for a given joint action. So rectus femoris, sartorius, tensor fasciae lata. What else do we have? Pectineus, gracilis, adductor magnus. Missing one. Yeah, they're all there. So iliacus, the psoas, psoas major, psoas minor, and so on. So lots of hip flexors. I may have mentioned a few in there that aren't officially on your list. So sagittal plane and frontal axis on that one. Okay. All right, so if this is not coming together and you're confused by it, what can you do? Stop by, office hours, right? Okay. All right, so just hang on to those. I think everybody's here today, so don't worry about turning them in, because if everybody's here, then I don't have to keep track. So 5 points for participation today. All right, so continuing on with chapter 2, muscle tissue has 4 unique properties: irritability, contractility, extensibility, and elasticity. So let's talk a little bit about each of these properties. Irritability or excitability is the ability of muscle tissue to respond to a stimulus, whether internal or external, and develop tension. So EMS units, electromyostimulation units, are designed to invoke involuntary contractions. So they're very useful for rehab in cases where a joint is immobilized and we're unable to move a joint voluntarily. We can still preserve muscle tissue through EMS. So sometimes moving a joint is not possible, in which case we can still allow muscles to be trained through artificial stimulation. It's also good for recovery. Recovery is really all about blood flow. So things that facilitate blood flow help with muscle recovery. So EMS is useful for that purpose. Contractility is unique for muscle cells, that they have this ability to develop tension. They can shorten. Muscle cells also have lots of nuclei, so they're multinucleated, and that's what makes muscles grow. So in response to stress, muscle cells will get bigger. So they'll increase their contractile content, and so they produce more force. Extensibility. A muscle can stretch. I should say a muscle and its associated tendon. As we do static type stretching, not only it's the muscle, but also the tendon that's lengthening as well. So timing is very important. So after workouts or on recovery days, extensibility, flexibility type training is nice to help preserve mobility. Elasticity is the ability of the muscle to return to baseline length following a stretch. So muscles have a certain rebound or spring quality. And it's not just the muscles, but really it's the tendons that are the springs of the body. So tendons are very resistant to stretch. They're like tough nylon cords that anchor muscles to bones. So if a muscle and its tendon undergo a quick stretch, there's a storage of energy, and that energy can be used to bolster muscle contraction. So we can do all kinds of jumping exercises that help us to learn to utilize the elastic properties of muscle. And so there you see Michael Jordan, and he had a 50-inch vertical leap, and in 1988 his foul line dunk, he was in the air exactly 0.94 seconds from takeoff to landing. And 0.94 seconds is just about as long as any human being can be off the ground. So the elite leapers on the planet. And I think I saw a video posted recently. He's close to 60 now, and I think he was at a basketball camp, and he can still dunk. So pretty good. Okay, so tendon, fibrous connective tissue, so it's cord-like in appearance, although we also have, we talked about last week, tendons that are internal to a muscle. Do you remember what those are called? Yeah. Aponeuroses, yes. So especially with the multipennate type of muscle. So muscles can be connected to bones through tendons, but muscles can also be connected to each other through these aponeuroses. So the muscles are like a highway system, that like roads that connect to each other, and muscle forces can pass from one muscle to the next. Some muscles share a common tendon, so the Achilles tendon is shared by the gastrocnemius and soleus. And so what's the joint action where we have extension of the ankle joint? What's the formal term for that? Yeah, plantar flexion. So it's really extension, but we say plantar flexion just because. I haven't looked up the history on that, but it's plantar flexion. Okay, so some muscles have multiple attachment points. So the triceps brachii is a great example. Triceps has 3 parts, so multiple points of origin for the triceps brachii. So in many cases, we can take a muscle and we can look at 2 attachment points. So a muscle has an origin. That's generally the more stable attachment point, the less movable attachment point. Muscles also have an insertion. So on the opposite end of a muscle will have a more movable attachment point. So let's take a look at an example here. So looking at the attachment points for the triceps brachii, we have points of origin for all 3 parts. So the long head has its origin up here, just below the glenoid fossa. So that's the socket for the shoulder. So the long head attaches at what's called the infraglenoid tubercle. Infra. What does the prefix infra mean? Supra is above, so infra is below. So infraglenoid tubercle would be a process just below the glenoid fossa. So this is our long head, and then we have a medial head that we can barely see. It kind of peeks around, and then it reappears down here. So you can see here distally the medial head kind of wraps around the long head and then has its insertion here. Lateral head kind of has its origin up here on the proximal portion of the humerus. So all 3 of these parts converge and have a common insertion down here at the olecranon. So we associate the triceps with what action at the elbow? Extension. So we think, okay, that's all the tricep does. Well, because the tricep has attachments up here, specifically the long head is also involved with actions at the shoulder. So if you've ever done a set of, say, pull-ups, no matter what grip, the long head is involved with adduction and extension of the shoulder joint. We wouldn't call it a prime mover. We would call it more of a assistant mover or a secondary mover rather than prime mover. It doesn't have the same amount of emphasis as, say, the lats in extending and adducting the shoulder, but it is involved to a certain degree due to its attachment point here with adduction and extension of the shoulder. Okay, so other example, biceps curl exercise. The origin is, again, up on the scapula, very similar to the long head of the triceps. And then the insertion is on the more movable part of the radius, so the radial tuberosity on the lateral side. So in most cases, a muscle will contract from the insertion in the direction of the origin. So that's a good test question. So in most cases, a muscle will have a very stable origin and will shorten or contract from the insertion in the direction of the origin. So a bicep curl exercise, the origin is up here, the insertion's down here, so from the insertion in the direction of the origin, shortening in that direction. So the point with this next one is sometimes that can be reversed where, say we're doing a supinated grip pull-up. In that case, the insertion is stable down here at the radius, and then we're moving the scapula towards the insertion. So that's not often the case, but most of the time it's insertion towards the origin. Okay, so types of muscle actions. We've already started in on this, so you're already well versed in these types of actions. Concentric, okay, we associate with shortening, lifting, against gravity. Okay, so gravity is really what we're working against, right? When we lift things, without gravity, things wouldn't have weight. And so when we do body weight exercises, what gives our bodies weight? Gravity. Okay, so it's really gravity that we're working against. This is a true contraction because muscles are actually shortening in this case. Eccentric actions. The muscle's not actually shortening, but it's lengthening. Lengthening under tension. So it's getting longer, but also resisting or controlling a load. So you lift your body up to where your chin is above a pull-up bar, and then what do? And then you lower it back down. So this is the lowering part. Lowering part controls joint motion. So in some of the other classes, actually you should have took this class before biomechanics. We talk a lot about this, so I won't be too boring with previous content, but we are much stronger eccentrically than we are concentrically. 30 to 70% stronger in lowering weight versus lifting weight. So when you do a 1-rep max test, is that a test of your lifting strength or your lowering strength? Lifting strength. When you do a bench press max, is the problem getting the weight from the start position down to your chest, or is the problem getting the weight from your chest back to the start? It's the lifting part. It's the lifting part that's maximal. The lowering part is submaximal. So do we do techniques that we place more emphasis on the lowering part? Sometimes. Okay, so we might have a training partner or other device that allows us to get greater load for the lowering part. And then we remove that extra load and then we do the lifting part. How many have done negatives? Yeah, negatives. That's where we're just working on the lowering part. And generally we can lower a lot more than we can lift one time. So there's all kinds of stuff that we do to challenge our muscles in both types of actions, but we need to understand that strength is different and it's greater in lowering than in lifting. Okay, so isometric is in the middle. Isometric, we're not moving, so it's not dynamic, it's static. This is very important in the body, especially in our mid-region here, because if we can be stable here, we can produce force more effectively through our arms and our legs. So remember the highway system concept, or we could even say the kinetic chain concept if you've heard of that. So we want to be able to transfer force effectively from the legs across our core here and into our arms. So throwing athletes, soccer athletes, volleyball athletes, cross-country athletes. What's what we got in here? I think I've covered everybody. You need to be stable here because you're more effectively able to put force into the ground, and the more force we put into the ground, the more force the ground puts back into us. Basketball, I missed basketball, sorry. Okay, so static action, so lots of planks. We train that stabilizing function really well, and there's all kinds of variations. So on Wednesday I'll bring what's called a lift dynamometer. Last time I used it, they were so strong they broke it, so I tried to super glue it, so I'm hoping it'll hold together. But we'll give it a shot here in class. So a lift dynamometer assesses how much force can be produced at a constant joint angle. So it turns out that force is also specific to joint angle. So we can produce more force at certain joint angles versus others. So the more you study, you realize how specific everything is. So it turns out that if we always train at a constant joint angle or with, say, a limited range of motion, guess what? Over time, our strength gains will be exactly at that joint angle or with a limited range of motion. So if we want to be strong through the entire range of motion, how do we have to train? We gotta do full range, right? We wanna be strong through the full range. Okay, so just that core stability concept, very important. Okay, so isokinetics. This is not another type of muscle action. Not another type of muscle action. This is a type of movement. So if you go to fitness professional conferences, there's usually some popular speakers within the industry that give kind of souped up kinesiology talks. And I heard one person one time refer to the 1990s as the isokinetics age. Isokinetics age, meaning that we don't use isokinetic machines too much anymore. The limitation being that you're seated on a machine and usually it's just a single joint and you're moving at a constant speed, which is really not specific to how we move as part of sport or in daily life. So they refer to it as the isokinetics age, but these types of machines still used to a certain degree today, and they used to be really, really popular. For research purposes especially, we were able to get the force velocity curve from isokinetics research. So the speed or velocity of movement is constant. So no matter how hard you push or pull, the machine that your limb is attached to will always move at the same rate. So you have to be really motivated to generate maximal effort throughout the entire range of motion, because no matter how hard you push or pull, the machine is going to move exactly based on the preset speed. And it's usually in degrees per second. The machine will rotate it in a circular manner in degrees per second. So here's what it looks like. So you can see this is a shoulder isokinetic device. This would be one for the lower extremities in knee extension and knee flexion. So a lot of research really useful in looking at muscle imbalances between limbs and also the ratio of quadricep to hamstring strength came from this type of research. So it does have a place in it, and we've gotten some very useful information from it. Okay, agonist muscles. Think of agonists as prime movers. So you have your entire movement and muscle handout showing a pretty good list of prime movers. Not exhaustive, but at least the ones that are emphasized in your textbook for all of those joint actions. So sometimes we can have multiple agonists contributing to a movement. That doesn't necessarily mean equal contribution, it just means multiple muscles contributing over multiple joints. Assistant movers. So rather than prime movers, sometimes I like to call these secondary movers. So for a barbell bench press, you might say the triceps brachii is a secondary mover. For a pull-up, you could say the traditional pull-up, a bicep brachii would be a secondary mover. So it's somewhat based on interpretation, what's a prime mover versus a secondary mover in some cases. So this brings up another concept, internal versus external attentional focus. So when we do an activity or a movement, weight training and so on, what are we thinking about? Is our focus internal or external? And that can really have an effect on what the outcome is. So thinking about what our goal is. So during a vertical jump, are we thinking about the muscles that are performing the jump, or do we have our eyes on the target overhead that we want to reach? So the target would be external or internal. That'd be an external focus, whereas if during a vertical jump we were thinking about the muscles that are extending the hip and the knees, that would be more of an internal focus. So it turns out that if you think about this, if the goal is producing maximal force, maximal power a 1 rep max or a maximal vertical jump or a maximal broad jump and so on, an external focus tends to be more effective. So if you're doing a broad jump and you put your eyes out there along the tape on a spot that you'd like to hit when you land, that's an external focus. If you're doing like a bicep curl like Arnold Schwarzenegger there, what type of focus you think would be best? So if hypertrophy or muscle size is your goal, what do you internal focus can produce a lot more activation. The difference is you're looking at a very limited amount of muscle with hypertrophy. You're trying to target and develop specific muscles. So it makes sense, an internal focus as well as concentration on a particular part, moving maybe a little bit slower. So your technique is just perfect. Whereas if the focus is on putting up as much weight as possible or producing as much power as possible, an external focus increasingly becomes more important. So in this particular study, they looked at a bicep curl, very simple study, and they had participants do bicep curls with 2 different types of focus, so internal versus external. They found with the internal attentional focus that the activity within the biceps brachii was significantly higher, which kind of fits in with the whole hypertrophy type of concept, if that is your goal. Look at torque though, with an external focus, putting as much force into the grip that you have on the handle. All of a sudden it's the external focus that is significantly more important. So attentional focus depends on what your goal is. So moving on from agonists to antagonists. Antagonists are muscles that work in opposition. So remember at the beginning of this chapter we had approximately 215 pairs of muscles that are antagonistic pairs. So we always go to our classic bicep, triceps, quadriceps, hamstrings, and so on. Lots of pairs of muscles that do opposing movements. So which part of that is active versus relaxed depends on the desired outcome. So if we want to flex the elbow joint, we have to have the triceps relax. So that inhibition takes place in the spinal cord. So the motor neuron that connects with the triceps is inhibited, enabling the motor neuron that connects with the bicep to initiate contraction. So muscles can also serve as stabilizers. So I don't want you to get the impression that a muscle is defined as a stabilizer all the time. So we can't put a muscle in a box and call it a stabilizer because muscles can take on multiple roles depending on the context. So in one case, a muscle might be a stabilizer, but in another case, it might be an agonist or antagonist. So fixator, it keeps a joint from doing what? Moving. So it fixes a joint at a certain position. So a fixator is really important, like what we saw today with the first example on our movement analysis. The arms were fixed in an abducted position, right? So the shoulder abductors were serving as stabilizers to enable the rotators to do their job. So muscles can have multiple roles. Okay, force couples. Force couples. So a couple means how many? Two. Okay, so at least two muscles that are contributing to a certain joint action. Muscles that are working together to accomplish a certain action. So upward rotation of the scapula. Let's take a look at what that looks like. It involves three muscles, the middle trapezius, lower trapezius, and serratus anterior, that each pull on the scapula to kind of turn it like a steering wheel. So we can see here we have the middle trapezius, the lower trapezius, and the serratus anterior. So you can see based on the fiber direction pulling down, pulling across, and pulling out, with all three of those muscles acting together, the scapula is going to rotate. It's going to rotate up. So that's important because to abduct the shoulder joint beyond 90 degrees, we have to have clearance underneath the acromion process. So otherwise we get impingement of the supraspinatus tendon on the humerus there. So we upwardly rotate to move this acromion into a position where we can go beyond 90 degrees of abduction. So we can go from here all the way to the top with shoulder abduction. Here's another example. So PPT stands for posterior pelvic tilt. APT stands for anterior pelvic tilt, right? So another example where we have forced couples. Okay? So in this case, posterior pelvic tilt can be achieved just like a steering wheel here. From a sagittal view, we have the upward pull from the rectus abdominis and external obliques. So pulling up on the front side of the pelvis. And then we have the gluteus maximus and hamstrings that are pulling down and back. So the complementary action of these muscles is to turn your pelvis back. So it's a posterior pelvic tilt. So in the same way, we have muscles that work together to achieve an anterior pelvic tilt. So the iliopsoas, which is actually three muscles, okay, so the two psoas, psoas major, minor, and iliacus. Iliopsoas pulls down from the front, and the erector spinae pulls up. Rectus femoris pulls down from the front. So now you're turning to the front. So muscles working together to produce rotation. All right, so how do we determine what muscles do? So where did your movement and muscle handout come from? So let's talk about that. A few different things to consider: lines of pull and attachment points. So what is the orientation of the muscle fibers? So if I was to go back, you can tell that the middle fibers of the trapezius are going to do what to the scapula if they're working all by themselves? The fibers are oriented from here at the insertion point to over here at the origin. Muscles work from their insertion towards the origin. So if this muscle's working all by itself, what's the scapula going to do? It's going to move in towards the spine. What do we call that? Not quite. Adduction, or for the scapula, it's retraction, right? Retraction. So moving in this way, and we can tell that because of these fibers. The orientation, they're almost completely horizontal, so they're going to pull the scapula in. So electromyography is another method that we can use, and we have 2 or 3 labs. This semester we'll do electromyography, so you'll be able to put these nice wireless electrodes on different points, and then you can look in real time which muscles are contributing the most to different actions. So fun lab. We also have that power power rack in there now where we can do a lot of stuff that we couldn't do before. So got some fun labs coming up right around the end of October. Okay, so electromyography uses surface electrodes, more invasive fine wire needles that are placed directly into a muscle to monitor muscle activity. So we have a very nice system that detects neural signals going to a muscle. So these electrodes are placed over the surface of the skin, and because muscles are contracting based on the signal from the nervous system, we can tell how strongly a muscle is contracting based on the magnitude of the EMG signal. So a few years ago, this was in 2014, I had the opportunity to go do some research up in Canada. So I was at Memorial University of Newfoundland, which is in St. John's, right there. So right on the Atlantic Ocean. First time I ever tried moose meatloaf. I got to eat dinner with Dr. Bain, and we had dinner. He took me to all the touristy type locations, but I had dinner one night. It was a blizzard in this tiny little shack right on the Atlantic Ocean. I was sitting there eating moose meatloaf. But he's one of the world leaders in EMG type of research. So his knowledge goes way beyond mine, but I was happy to be able to go and learn in his lab. And so what we did is several different types of movements. This is obviously a kind of a partial squat movement. You can see that the EMG system that Dr. Bain was using for this study involved all of these wires. So one of the nice things that's kind of advanced in EMG technology is these wireless surface electrodes. So we can go outside the lab and we can do things that are, we can still do practical stuff with the wire but it's a lot more cumbersome. You kind of have to make sure the wires are out of the way. This was a hip bridge that we were doing. You can see cable tensiometer down here. So this monitors the amount of force during a hip bridge, and then we had all kinds of electrodes that were feeding information on muscle involvement. But nice trip, and I learned a lot from him. So anatomical lines of pull is another way that we can look at muscle involvement. And looking at joint axes. So if we were to look at the left leg and take a cross section of the left leg, and we can see all of these muscles, we could say everything on the anterior side of this line, so everything in front of the joint axis would contribute to knee extension, whereas everything behind this axis, do you think would do what? Maybe more of a knee flexor. So you have all of your hamstrings, and then in the medial compartment over here, okay, so you have your adductors. In the lateral compartment over here, you have muscles that to a certain degree externally rotate the knee joint as well as abduct at the hip as well. So, okay, so are there any questions at this point? How are we doing on time? Okay, I want to go just a little bit more. I know it's lots of information. Do we have any questions? Okay, all right, let's do just a little bit more and then we'll call it a day. So peripheral nervous system. So we have nerves that relay information to and from the periphery of our body. So when we talk about the periphery, we're talking about everything outside the brain and the spinal cord. So the brain and spinal cord are the master integrators. So you have information coming in from the periphery, carrying information about all aspects of our bodies, including movement. And then you generate responses in the spinal cord and brain, and that information is relayed back out through motor neurons. So we have 31 pairs of spinal nerves and they're all mixed. 31 pairs of spinal nerves and they're all mixed. That means that each spinal nerve has both motor and sensory nerve cells. So sensory, sometimes called afferent, those are nerve cells that carry information from the periphery into the spinal cord. Motor or efferent, these are nerve cells that carry information from the spinal cord back into the periphery, out to the periphery. So all 31 pairs of spinal nerves have both types of nerve cells. So they're called mixed. So here's our 31. We have 8 cervical, 12 thoracic, so that's 20, and then 5 lumbar, 5 sacral, so that's 30, and then 31 with our coccygeal. So anatomically, C1 through C7, they exit above the corresponding vertebrae, whereas C8 all the way down through the one coccygeal, they exit below the corresponding vertebrae. So if you look at this picture, C1 through C7 exit above the corresponding vertebrae. So C1 is here, and then the corresponding vertebrae is here. But then when you get down to C8, you'll notice that it's below the corresponding vertebrae. So T1 is here. Thoracic 2, the second thoracic vertebrae is here, all the way down. So this gives you a sense of which muscles are controlled by different spinal nerves and so on. So head movement, diaphragm, neck and shoulders, upper limbs, rib movement, breathing, and then hip movement, lower limb movement, all the way down. So one of the things that I really emphasize in this class is memorizing spinal nerves that connect with each muscle. So that'll come in as we go. The best way when you have a bunch of information is to take it piece by piece. So you memorize the nerves that control the scapula, then you memorize the nerves that control the muscles of the shoulder, and then the elbow, and so on. So pretty soon you've memorized all these nerves, and we just take it chapter by chapter. So from a sensory standpoint, we have defined areas that are controlled by certain afferent nerves. So these are the dermatomes. So this is a map of the dermatome, so you can see the regions of skin that are connected to each spinal nerve. So you can see the spinal nerve listed there. We also have myotomes, muscles or groups of muscles that are controlled by a specific spinal nerve. So this is directly from your text. I apologize, the scan didn't come out as good as I wanted to, but for the most part, I don't want to focus too much on the dermatomes, but more on the myotomes. So which muscles are controlled by which spinal nerves? You can see in this case, C5 controls these muscles: supraspinatus, infraspinatus, deltoid, biceps brachii. So functional application, one of them would be shoulder abduction. Another example, we could go down to C6. The myotome, the muscles, would be bicep brachii, supraspinatus, wrist extensors. Application would be elbow flexion, wrist extension, and so on. So as we go through each chapter, you'll be memorizing which spinal nerve connects with which muscle is my goal. So by the end of the class, you'll know all of them. Okay, so neurons, nerve cells. Neurons are specialized in that they can conduct electrical current. And so most of the neurons in the body are located in the central nervous system. But each neuron has 3 parts in common. So there's a cell body, and then we have these extensions from the cell body called dendrites, and dendrites connect with other nerves. So it's like a network, so nerves communicate with each other. So messages from dendrites go to the cell body, where we have a summation of excitatory and inhibitory input. And then if there's enough excitatory, that signal will be relayed along the axon. So 3 different parts: cell body, dendrites, and then the axon, which then relays a signal to several other neurons in the tract. So 3 different types of neurons. So motor neurons, do you remember the functional application? Motor neurons, which direction? Out. So from the spinal cord out to the periphery. So this is your typical motor neuron right here. So dendrites bring information to the cell body, some of it excitatory, some of it inhibitory, and this summation process goes on. If we have enough excitatory, that signal will then be conducted and continued through the axon, and that axon can connect with other nerve cells or tissue like muscle cells. Sensory neurons. So from the periphery into the spinal cord, and this is your typical sensory neuron here. So you can see the skin with a sensory receptor that relays information in the direction into the spinal cord. And then lastly, the interneuron is only in the central nervous system. So 99% of all neurons in the body are interneurons, and they're located only within the brain and the spinal cord. So think of how much integration you have going on in the spinal cord and in the brain. As we move and become better at movement, those connections in the spinal cord and brain become more efficient. So we're then able to activate just the right amount of muscle. So we're not wasting any energy. We don't have any compensatory type of movement patterns. We're just able to move in the best way possible so that we avoid injuries. Okay, so I'd like to use this as our stopping point. So Wednesday we'll pick it up and we'll talk about 2 proprioceptors specific to skeletal muscle. So are there any questions before we conclude? Okay, so, all right, so I do have office hours if you need help. I'm going to go down there for a few minutes. I do have a meeting at 2 o'clock, but if you want to come down and chat for a few minutes, please do. Thank you.